Good morning. So for decades in Nigeria, a person who attempted suicide could find themselves facing the police before they ever reached a mental health professional. The question was not often what happened to you, but what offense have you committed? And now Nigeria is taking a different direction. The Federal Executive Council has approved an amendment to the National Mental Health Act that will decriminalize attempted suicide. That's a move from punishment towards care, treatment, and support. But changing the law is only the beginning, because behind every suicide attempt is a person in distress. And if we want to prevent suicide, we have to understand what pushes people towards that point, how to recognize the warning signs, and what happens after the crisis. So today on Jasiri, we are asking what Nigerians' shift from punishment to support could mean and what still needs to change. All of this will happen later, but first.
In less than 2 weeks, two separate incidents in communities around Okehi local government area have reportedly claimed the lives of several people after they consumed Amala, made from cassava flour. Ohikwe, a woman, lost her husband and two of her children after the family ate the meal. Days later, in Ihima, the neighboring Kogi, another food-related incident claimed more lives, with survivors also hospitalized. The circumstances surrounding the deaths are yet to be conclusively established. Medical officials in the Ihima case have described food poisoning as a presumptive diagnosis, while samples have been collected for further analysis. Our correspondent, Mana Balogbogbo, has been following the developments from Kogi State, and he joins us live from Lokoja. Good morning, Mana. How are you today? All right.
Oh, I'm great.
All right. We're looking at two...
Good morning, Lolo.
Good morning to you. We're looking at two disturbing incidents involving Amala and cassava flour within days of each other. What do we actually know about these two cases? How many casualties are we looking at? And is there anything that points or suggests that the two of these incidences are connected?
Thank you so much. Let's start with the connection. First, it happened in the same local government area, which is Okehi local government in Kogi Central. And they're just a few meters apart, quite a long distance, I would say 1 hour drive from Ihima, which is the one that blew the whole situation, because the community in Okehi happened just a week before the one that, of course, got national action. So that is the connection, that it happened in the same local government area. And from the findings from both the public health officials and the police, the suspected poisoning is, of course, cassava flour. And the fact that it happened in the same local government area could point to a situation of perhaps the supply. Maybe the cassava product was not properly processed, and perhaps that was what led to the poisoning. There are so many theories, but we don't want to dwell on the theories. Some people are saying it could have been from the home. According to the doctors that we spoke with at the Kogi State Teaching Hospital in Okehi, they suspect poison, so they're not really looking at the cassava flour itself, but public health officials, of course, are making reference to that possibility. So the samples of the food have been sent to a veterinary hospital in Plateau State, so they will do analysis, and the commissioner of police said they would give us feedback with the results. So let's get down to the casualties, looking at the numbers. In Ihima community, 9 persons were affected, including her family, her husband, 2 of her children, and then her neighbor, and then the neighbor's children. So that summed the total to 9. So out of that 9, 5 persons died, with the toll rising to 5. That was on Sunday morning when we got to the hospital. And then the remaining 2 are feeling better, and then the 2 we met at the hospital on Sunday are feeling much more better. They were discharged from the hospital, and then when we got to Ohuekpe, we spoke to the woman. She couldn't really speak. She's very depressed. I mean, she prepared this Amala and her husband. She lost her son. She lost her daughter. And it's just really devastating. We spoke to the daughter also yesterday at Okehi, and it's just so tragic that these two cases in the same local government area, I mean, has left to the death a total number of about 8 so far. Really sad. Back to you.
Okay, Mona, there's been a lot of talk about food poisoning, but we've also heard suggestions about contaminated cassava flour, poisonous or improperly processed cassava, even possible contamination of the food after preparation. But let me ask you, from the medical and investigative information that you've gathered, what is actually established right now?
All right. The chief consultant of family medicine at Kogi State Teaching Hospital told us specifically that it is food poison. So the challenge now, Tolu, is the fact that because of the religious beliefs of people in Africa, not just in the Ihima local government area, as regards having to do an autopsy, because that will clearly tell you scientifically what led to the cause. So the families immediately bury they are dead, and then the lady, she died that same day for false burial. So these is a client they can't really give us a clear cause of death. So what they are saying are presumptive, and he said presumptive is 85%. 85% sure that it's food poison. 10% is also statistically significant. Results from the medical facilities have been sent. We won't really get a clear. But of course, public officials are also raising up the theory of epidemiology, which has to do with environment plays in affecting the health of people in that particular community. But we spoke exclusively, and she told us that she doesn't have some chemicals. Some people were even saying maybe rat poison, rat that had consumed poison, then smelt into the food, just all sorts of theories that we have been hearing. But of course, until those results come in, we won't really be able to say categorically what happened. But that was the position. And there was another position of maybe somebody was trying to kill somebody, but herself, Hawa Nanajino, she doesn't suspect anybody. And from what we gathered in the community, I mean, communal fellowship in terms of, having meals together is something in Ihima local government area. I could come to my friend's place in the community and then sit down and eat. What incidents, is really raising eyebrows as to if that will continue. And of course, sort of fears now regarding cassava flour consumption. Back to you.
All right, Mono. Beyond these particular cases in Kogi, what should families be doing differently when preparing or maybe storing and consuming food, particularly cassava-based foods and leftovers? And what should someone do when symptoms of maybe suspected food poisoning maybe begins to show? What should anyone do?
Okay, that's a great question. The public health officials put out statements, and I'm just going to read some of resolutions as to how to help to prevent this. They talked about they talked about community sensitization on early presentation. If there is a gap, it could lead to casualties just from what we saw. And they also talked about avoiding self-medication and unknown concussions when ill, which is also some of the reasons that the doctors at the hospital pointed to the fact that they lost some patients because they straight away, I think, of them went to take herbs and some other mixtures, which they as medical professionals can't really vouch for. And they believe that also contributed to the increase of the death toll. And in terms of the consumption of flour, you know how it is. I mean, it's really challenging in terms of, affordability, being able to buy maybe a bag of semovita. I hope I'm not promoting any brand now, but other kinds of flour that is properly produced in bags. So people turn to these options, which of course we grew up in. I remember my grandmom making Amala. Those are the things we were consuming before all this merchandising of flour and into various like wheats that we consume nowadays. So it's really, really a concern. And the Commissioner for Information, when he put out a statement to us, he told us that they are, tracing the source of food, and then they will look into it and then make other observations and come out with more details. But basically, people will really have to be careful of where they get their particular food products, and I think that is a major concern. Whoever you're buying your food from, you have to trust that the source is well protected in the sense that it follows due process in terms of all the health concerns that will require proper processing of cassava flour, which we all know that because of the chemical composition of cassava, it has to be properly processed. If not, it becomes poisonous. But aside that, I mean, we can't really say if maybe someone committed this atrocity by actually putting substances into their food. So perhaps the environment may be contributed one way or the other. But people will have to be very, very careful.
All right. Thank you very much, Mono, for that update that you're giving us. We hope we'll get some more updates when the actual results come back from the lab to actually tell us what the true cause of these deaths are. Thank you. Honestly, I believe that we need to really be careful about food. And that's why I think of people that actually take care of our food, like maybe Consumer Protection Agency. We're talking about Standard Organization of Nigeria. They need to really, really zoom in on some products or all products, basically, because there are all sorts of food practices, preparations. Everybody is bagging different kinds of things. Yeah. And we need to really, really be careful, maybe where you buy your food, because until they know what the cause of these deaths are, you never know what could have actually caused these deaths in Kogi State. It's really devastating.
And that's only Kogi. No one really knows. Remember when we took that report when we were examining the
cassava,
came out
fufu.
Yes, I think it was in
Hypo. That they put they put detergents to.
And to me, it was unbelievable. It was, you cannot believe it until you actually see it. So when you see that these kinds of things exist, you wonder, are we wicked unto ourselves? Or you that is mixing all those things, would you eat it?
Yeah, but they do. The thing is that many people do not, many things are just handed down to you. No, somebody will just tell you, I do this and it worked. They don't really think about the implication of what
I think
they're doing.
Thing is actually greed, the need for you to actually make quick cash, right? And then you find out that, I think it starts from the farmers as well. You find the farmers, when they're farming, they put in so much fertilizer, saying that, it grows fast, it helps faster, bigger, and all that. And in turn, you end up poisoning. And then when you harvest and then you take it to the, a retailer, the retailer now decides to
add some more
pesticide so that, insects do not, feast on it, or it preserves it or something. And then when it gets to the consumers, it becomes poison.
Honestly.
Yeah, it does, especially when I think at some point, there's a time when it was beans that was...
Yes, a lot of times they will say they sprayed a lot. Somebody will spray...
fish.
But we've had a lot of it. Remember when it was plastic rice?
Yeah.
We've had different things.
Honestly, I won't lie to you. I bought a bag of rice that if anybody tells me, if I was able to really test it, I would really believe that it's just not like rice. It just feels the texture is off. The taste is off. It takes forever to boil. As in, you keep adding water, the rice will keep swelling. In the olden days, you'd have thought that, maybe the rice is very dry, so it consumes a lot of water. But there was a weirdness to it. And I did see another person that caught some guy putting yams in gutter.
And doing what? Washing it?
He said he was preserving it. That the community stayed there and made him pull out all
How about
the cassava.
watermelon being put in something?
Or injecting like syrup, sugar syrup into fruits and all that. That is also a practice. You know, I was online the other day, and then I saw someone advising people on how to make sure they wash their rice before they cook it and all that. So people were dropping comments on how they do it and all that. Do you know how I cook my rice? I soak it for minutes first, right? No, I wash it, then soak it for minutes, wash it again, parboil it.
Yes.
Before
I parboil my rice.
I cook it.
I parboil it, then I make sure that the starch comes out. I wash and wash until it runs clear.
So how do you parboil? Okay,
very...
so something like mangoes that they put in gutters now.
I don't know.
Ripen. How do you
Are we going
wash
to be
that
cooking
out?
mango?
What about apples that they use some kind of wax to preserve
To
it?
preserve, yes.
So you're right to use hot water or warm water to wash your apples so it melts it off before you eat it.
When you wash apples with hot water, it softens it and destroys the taste.
Exactly.
How many people know this? So
Even beans, I parboil beans because I'm so scared of beans, even more than rice. I parboil my beans, then I wash it out as if I'm just washing my rice before I continue cooking it.
This is a conversation that we'll ultimately get back to because nothing misses or nothing they pass us on this table. Let me put it in pidgin. But we have to go for a break. Nigeria may be moving away from criminalizing attempted suicide, but what happens when someone is actually in crisis? What should the police do? What should hospitals do? It's as if we can't even win. What should families even do? Most importantly, what should an ordinary person do when someone says they no longer want to live? So we'll take this break, because after the break, mental health advocate Kunle Pelemo joins us to unpack the law, the psychology of societal distress, and what meaningful support should look like. Stay with us.
Well, for years, attempted suicide has been treated as a criminal offense under Nigeria's criminal laws. But the country already has a National Mental Health Act built around dignity, treatment, protection, and psychosocial support. Now, the Federal Executive Council has approved an amendment aimed at removing criminal penalties for attempted suicide, with the proposal expected to go before the National Assembly. So what will this change actually mean for a person in crisis? Our guest has spent years advocating for suicide prevention and practical mental health support. Kunle Pelemo, mental health advocate, author of Mental Hygiene, and founder of the Empower Mental Drive Foundation, joins us. Mr. Pelemo, thank you so much for joining us on Jasiri. I got
Wow.
It's a pleasure to have you.
Yeah, and we're feeling the vibes and the enthusiasm. And before we got here, Mr. Pelemo would intimate us that he's a fantastic dancer. And of course, we did nominate a member of the team, you know, to engage him in a dance-off. So it will be good for your mental health. Dancing is good.
Absolutely. We did dance this morning.
Yeah. So, Mr. Pelemo, let's get right into the heart of the matter. Let's talk about this reform. What is wrong with treating maybe a suicide attempt primarily as a criminal offense, you know, rather than a mental crisis? If Ihima was here, even though I don't agree with her sometimes, I know she'll say something like, it was still an attempted murder. The person still tried to buy himself. So it's kind of premeditated, like, you know, other criminal offenses. You know, that's one of our colleagues' standpoint on it. So what would you say is the difference between somebody that tried to kill himself or maybe someone that killed another person? What would you say is the difference, and why should they be treated differently?
Okay. Thank you very much. And this has been some of the questions that had created a lot of debates as regards criminalizing suicide in society. And Nigeria has suffered from that for a very long time. The difference is simple. People who take their lives. And the first thing that I also want to do now is to create an awareness about change in vocabulary. You know, rather than saying commit suicide, it's better to say someone someone took his life or someone died by suicide. That little change in the world will make people come out the more. And you see, as we are moving from the criminalization of suicide to decriminalizing it right now, it's no longer a crime. So using the word commit now, I mean, that speaks volumes in that regard. So people who take their life, they are people who actually need help, because suicide is a complex issue. But one of the major reasons why most people take their lives, I'm not saying that's the sole reason, but it has to do with mental health related issue. So how do we punish someone who needs help? And that's the difference from someone who took someone else's life, which is murder, and then someone who takes his life as a result of not being able to withstand all the pressure that he's been through, or even mental illness or ailment, so to speak. So if you go ahead to punish someone as such, then you have so many people who are going through such things and they will not come out to ask for help. And thereby we are pushing a huge number of people through suicidal thoughts and then even suicide at the end of the day.
Which leads me directly to my question, where I'm saying, so the Federal Executive Council has approved this amendment instead to remove criminal penalties, like we've established for attempted suicide, replacing it with care, you know, and support. And it's actually expected to go before the National Assembly. Now, my question is, could decriminalization actually encourage people to speak up sooner, or are there any other lacunas that we haven't looked at?
Yeah, I think for every law there might be lacuna in one way or the other, which is the hole people can plug into. And that could also be like the argument some people will make that now that it's been decriminalized, a lot of people might want to attempt suicide, you know, feeling that, okay, it's no longer a crime. But the truth is, criminalizing it is wrong. And you don't right a wrong with another wrong. So that takes away the criminalizing suicide on its own. So now when we move forward to take the step to care for people, and I think that is where the solution lies. Even though that might not offer the entire solution, but it's a very good platform to start, because people will now be free to come out, to speak up as regards whatever mental health related issues they are passing through that is creating suicidal thoughts in them, suicidal ideation in them. Because one of the major reasons we have underreported cases in Africa, it's this particular reason, because they feel it's a crime. So someone took his life, the family member will say, do not even talk about it. And the World Health Organization has said that countries, you know, in Africa, they have underreported cases. So we don't really even know the extent of the problem, because most people don't come out to talk about it because they feel it's a crime. But now that it's been decriminalized, I think it is long overdue, but it is laudable at the same time.
Well, I said it earlier that Nigeria already has the National Mental Health Act, right? Which provides for dignity, protection, treatment of psychosocial support, and the likes. So, but there has been a huge gap, you know, between what the law says and how people have been treated. You know, just like you've always said, you also said, you know, if this amendment, you know, becomes law, what should happen differently in the first few hours after someone survives a suicide attempt? That's one question. And then, who should take responsibility for the next stage? Is it the police, since we're still trying to decriminalize it? You know, is it emergency medical personnel, psychiatrists, psychologists, social workers, family members, or all of them? And what should the chain of care look like?
Okay, thank you. That's an amazing question. That's very wonderful. Because this particular Mental Health Act that we talk about, that's the 2021 Mental Health Act, has a lacuna as a result of the penal code associated, you know, with suicide. And that's what the Minister for Health, Professor Muhammad Ali Pate, was trying to figure out, how to really move from just change of law. Because when we say we decriminalize suicide, yeah, that's just the change of law, to a reform. So when it becomes a reform, and I think that's what the minister is pushing towards, it will move forward from just saying, yes, this is no longer a crime, to what do we do for an individual who had attempted suicide? And that speaks to what you asked.
The next stage.
Who are the people? Yes. What's the next stage? How do we care for those people? And I feel it's going to be a joint effort, by a whole lot of people. You talk about the caregiver, you talk about the police, you talk about psychologists, psychiatrists, social workers, even family members as well. So it will be an all-encompassing, organized approach. And I think the government has to start this. And, one of the things that I have pushed for, relentlessly is including mental health in primary health care. So in hospitals, in, public hospitals, public health care, there should be someone who attends to the mental health, of people who come to those places. So all of these things put together, I feel is what the government should do in order to create an organized approach to, individuals, to helping individuals who had attempted suicide.
All right. I know you have actually talked about removing punishment and putting in maybe prevention. You have mentioned it in between what you said. So I don't think we should, go again in that direction. So after we've been able to decriminalize, what should we put in place alongside decriminalizing? Because that's one thing. But when we remove punishment, because if we remove the punishment, but we don't improve other things that make this ideation to come to people, things like access to care, what problems have we really solved? Because you're saying, okay, it's no longer a crime, but mental health hospitals doesn't have adequate funding, doesn't have doctors, so many other things. Life is still difficult. So what are we going to put alongside it? And what next steps would you recommend that we should take once this proposal is approved? Because, it's still on the table, being read, but we have to start making plans towards it that, okay, once they have made this into law, what do we need to put side by side? I'm talking about maybe the National Assembly, health authorities, state government. What should we prioritize for this legal reform to really make the difference that we expect it to make?
That's a lot. That's a lot. The first thing is funding. Government has to provide funding for mental health. And I think mental health, from what I gathered, in the budget of, the health budget, mental health takes only 5% in the entire budget, and that's very low. And if you really want to move from, protecting the people to also creating recovery for them, it starts from early intervention. So you even want to prevent people from attempting suicide, even though those cases will occur. But I think what the country needs to do is to find a holistic approach, organized approach, and which I mentioned earlier on. There will be funding, there will be massive awareness. Part of what we're doing speaks to that, whereby people understand that it is not weak to speak. Asking for help is not a sign of weakness. Whenever you are going through whatever mental health related issues you're having, but most importantly, how well will you be able to find help? Because there is a major gap between mental health worker and those people who are in a crisis.
Yeah.
I think it's between ratio 1 to 300,000. So for a caregiver now to 300,000 people. So you see that's it.
Staggering. I was just going to say that we're having, the death of doctors is already prevalent in other health sectors, even in hospitals. Now, if we're narrowing it down to mental health specialists, I think the ratio would even be higher. But I didn't even think it would be that high.
And to even further buttress this point, this particular statistic was gotten when the Japa syndrome had not been, this terrible.
Wow.
So, a lot of people had left and all the rest. So I'm sure it will have even reduced further in terms of the ratio of caregiver to patient, mental health patient. Wow. So a lot of funding needs to be done. Government needs to create like that architecture, that platform that other people can, now buy into and operate within.
All right, let's take a short break here because changing the law may change how we respond after an attempt, but the prevention of suicide has to begin much earlier. Sometimes with recognizing a change in someone's behavior, listening when they say they're struggling, and knowing what to do when the warning signs appear. We'll get practical after the break. How do you actually help someone who may be suicidal? We'll be right back.
All right, sadly, we need to wrap up our conversation with Mr. Pelemo now, but then we'll have him back, definitely. Right about now, we will be going to Rivers State, where security leaders, lawyers, and policymakers are examining the legal and institutional gaps contributing to Nigeria's growing insecurity, particularly the activities of armed groups and what is commonly described as unknown or known gunmen.